TRT, testosterone replacement therapy, is completely different to a steroid cycle. And what is a steroid cycle? A steroid cycle, in my eyes, is anything, and in the doctor's field, is anything above normal levels. Now, you may not be taking that much. You might be taking 150 milligrams. But if that puts you above normal levels, you're on a steroid cycle, mate. Now, if someone's got naturally high testosterone levels and they go on testosterone, if they go on, say, 80 milligrams a week, that could put them over natural levels as well. So they're, in actual fact, on a steroid cycle as well, if they're over the normal levels. So I debate people quite a lot on YouTube and that. It doesn't matter how much you take. If you're over the normal levels, you're on a cycle. Testosterone replacement therapy is to replace your normal levels. If you're above the normal levels, you're not on TRT anymore. I see so many people saying, I'm on 250 milligrams. Today, someone even said they're on 500 milligrams a week and feel amazing. Of course you feel amazing. You're going to feel like Superman. You're on a steroid cycle. I've took steroid cycles in the past and I felt superhuman, felt the best I've ever felt. But on the inside, I must have been hanging. Now, obviously feeling amazing is one of the benefits of being on TRT, but you can also feel amazing when you're abusing it on steroids. And that's what I can't understand about these doctors. They put them on these they start them on like 200 milligrams a week, a starting one. As with anything, it's better to start low and work your way up, because then you can, if you start on a high dose, you're going to get all sorts of problems in your blood work and you're not exactly going to know where it's coming from. But if you start low and you get a side effect creep in, you can work on that one side effect one at a time. But if you start very high and you get a few side effects, you don't know where it's coming from and you don't know how to act on it. People need more testosterone than other people, I realise that. But that is why every single person is different. Genetics are different, their physiology is different. So that is why everyone is on different levels of testosterone intake. If you're a man in your 60s with very low testosterone, you're going to need a completely different amount to a man in his 20s with a mediocre amount of testosterone. That is why there's no generic dose to put an individual on. Every case is different. Everyone's testosterone levels are different, so they're going to need a different amount of testosterone put into their body. So when someone says, well, I've read the perfect dose to start on is 150 milligrams, everyone starts on 150 milligrams a week. No, there's no right starting dose. You get a blood work done, it goes off to the lab, the doctor looks at it and works out how much you are personally going to need. It's not generic. You'll go on these pages and you'll get a lot of people who convince themselves that are on a steroid cycle, that they're on TRT. And I think a lot of people now genuinely think TRT is a steroid cycle. And I also don't think it's necessarily their fault. I think some private doctors, I'm not saying private doctors in this country, but there's private doctors out there, which as long as you keep paying them and you're happy, they're going to want to keep you. So if you're unhappy with the dose you're on, they're going to say, all right, what makes you happy? And you're going to say, well, I think I'll be happy on more. They're going to give you more testosterone because they want to keep your custom and they want money coming in every single week. So these people that are on 500 milligrams a week, they do genuinely think that they're on testosterone replacement therapy, even they're on about 3 times more than what they should be, because their doctor's giving it to them. And that's all good and well for the patient, isn't it? I got prescribed testosterone, I'm gaining muscle, I feel beastly, and I feel amazing. So, you're going to argue the facts, ain't you? I mean, you got some random bloke saying to you, oh, you're on a steroid cycle, but you're getting prescribed it from a doctor as TRT, then you're going to argue it with people. So I can't really blame them in a way. And these people, no doubt, have problems with their blood work. They won't upload it, they won't show you it, but they'll say they're on a ton of different AIs just to try and make their blood work normal. So the doctor's on a win-win. He's got a patient paying him loads of money for testosterone, and now he's giving them more money for AIs as well. All I'm saying is people just need to educate themselves. Whenever I get into something, I research something for at least 6 months to a year before, just so I know every single detail. I've read loads of different papers, I've read reviews from actual patients, and I've got my knowledge to a high point where I'm sure I'm making the right decision. But look, there's people out there which are bodybuilders, powerlifters, strongmen. They want to be on a steroid cycle, but they also want it to be legal and accepted by people. So they go to these doctors and they get given this testosterone, and they get to call it testosterone replacement therapy when it's not, it's bollocks. But if they're happy, I mean, who am I to argue really? If that's what they want to do, then happy days. But do not call it testosterone replacement therapy, because you're not replacing your natural testosterone, you're adding to it. You're adding ridiculous amounts to it. I mean, there is a trick in there. You go on a steroid cycle, you come off it, your testosterone completely crashes because your natural levels have gone now because you've been taking artificial testosterone, and then they go get a blood test and obviously they've got zero testosterone. So now they get prescribed loads of testosterone. There's tricks around it, but it's the wrong way to do it. If you actually want to be healthy and you want your well-being to be top of the game, don't do it these ways. Do it the proper way. Just because you look physically healthy doesn't mean you are. You could have all the muscles in the world, you might look like the perfect human being, but you look inside your body, your visceral fat, the fat that like surrounds your organs, is growing by the day. Look, it's not good for your heart, it's not good for your blood, it's not good for your brain. It may be good for your muscles and it may be good for the gym, but you need to think about the long run, mate. You may look and feel good now, but years down the line, you're going to regret it. You're going to regret it. Dorian Yates, for example, an Olympia bodybuilder, English from years ago, absolutely massive, smashed it for years, completely ruined his body and mind. I mean, at the time, obviously, that's exactly what he wanted, but now he realises the abuse that he put his body and mind through, and all he works on now is his well-being and his wellness, because that is the most important thing, after all, your wellness and well-being. It's all about being healthy. Testosterone replacement therapy is all about making you healthy, bringing your physiology, your body chemistry back to normal levels, back where you can come back and control yourself, control your own body and control your own mind.